Equally important is the fact that pantethine does not have any side effects. Compared to a drug like Mevacor, which is the most commonly prescribed cholesterol-lowering agent, Mevacor causes elevations of liver enzymes, which is a euphemism for saying it damages the liver. It may cause problems with visual function as well, and it causes a depletion of a very important nutrient called coenzyme Q10. We'll get into this a little bit later. Coenzyme Q10 has now been shown to be life-saving for certain forms of serious heart disease. It also helps heal diseased gums. It helps with immune function, and it's being used in AIDS patients now. And coenzyme Q10 is depleted by drugs like Mevacor and Pravachol. So if you're trying to prevent heart disease with a cholesterol-lowering drug, and then you deplete one of the most important cardiac nutrients, then that's not very wise. In my humble opinion, and my opinion has been known to be humble on occasion, any physician who prescribes Mevacor or Pravachol and does not advise the patient to take coenzyme Q10 along with it is guilty of medical malpractice. Now, unfortunately, the definition of medical malpractice is failure to conform to community standards, which, as we said earlier, was institutionalized mediocrity. So, whereas people get harmed, everybody else is doing it, so there's nothing wrong with it. And this is the standard of care. And then we get up there and we start doing all these different things that are deviant. Deviant is merely a statistical term. It means nobody else is doing it. And we believe it's superior medicine, but then they say you're failing to conform to the standards of care, you can't practice anymore. So I say, yeah, we refuse to conform to the standards of care because we like to be better than that. But in Jonathan's state, there's now a law that prohibits the board from coming after you if the only reason is that you're different. You have to demonstrate that the patients are being exposed to unreasonable risk of harm. In my state, Maryland, that bill has come up 3 times and it's been voted down 3 times, and the legislators are afraid that all these bizarre weirdos are going to come in and start doing strange things to people. But again, strange and bizarre and weird are statistical terms. It's just deviating from the norm. And it is possible to be different and also to be a bad doctor. And there are some people out there that I could probably find and say that about, but in general, the people that I know that deviate from the norm deviate because they're doing a better job. So, back to the cholesterol. Pantethine can be used. Also, you can use chromium. Chromium has been shown in both human and animal studies to lower serum cholesterol and to raise the friendly HDL form. And the dosage that we usually use is anywhere from 200 micrograms to 1,000 micrograms a day. In some cases, we go a little higher than that. Chromium is very safe, and there are no trace mineral or other vitamin interactions that we know of, so we don't worry about balancing that with anything. When you use chromium, you can also use a little bit of niacin. And the combination of chromium plus niacin works better than either one alone as far as lowering total serum cholesterol. The reason probably is, have any of you heard of the term glucose tolerance factor? Okay, we've got some people that read here. Glucose tolerance factor is involved with improving blood sugar in diabetics, raising the blood sugar in hypoglycemics, and lowering the cholesterol and raising the good cholesterol. So it's one of these branch points in metabolism. And glucose tolerance factor is made in the body from chromium and from niacin. And the human body in this century is often deficient in niacin. And the reason is that when we consume enriched bread, I don't know why they call it enriched. You remember Sugar Blues by William Dufty? Well, in this bread, they take out about 20 nutrients that we know of, and they put back 3. And they call it enriched. Dufty said if Dracula came and sucked your blood and then gave you a vitamin B12 shot before he flew out the window, would you say you'd been had or enriched? So this is what they do to Wonder Bread, which is so named because it's a wonder that anybody that consumes it is still walking around. They enrich this bread, and they do put back niacinamide because if they don't, you would get pellagra. As Fredericks said, Carlton Fredericks, your diet has, by this enriching process, they change it from atrocious to merely poor. But they put back niacinamide when they originally had niacin. We were taught that there's no difference between the two, but you all know that's not true because niacin makes you flush and niacinamide does not. And niacin will lower your cholesterol, and niacinamide will not. So there are some differences. The human body cannot manufacture niacin from niacinamide. So therefore, whereas we can prevent pellagra with niacinamide, we do not get this small cholesterol-lowering effect. And what is the other way the body makes niacin? From tryptophan, which is now illegal as a supplement. It's still legal in your food, like if you eat a hamburger, there's plenty of tryptophan in there, or some other animal proteins. But the way we prepare our food today with harsh heat treatments, harsh alkali and acid treatments, we tend to destroy a lot of the tryptophan. So the two major sources of our niacin today have been lost, and therefore supplementing with even a small nutritional dose of niacin, not a mega dose, can be often helpful in combination with the chromium. What I recommend is, in addition to the pantethine, 200 to 1,000 micrograms of chromium and 50 to 100 milligrams of niacin. That is a very small amount of niacin as things go. The medical doctors often recommend 1,000, 2,000, 3,000 milligrams of niacin, and that can actually damage your liver if you go up in those levels. But 100 milligrams of niacin per day is perfectly safe. In some people, it does cause a minor skin flush. But it's usually minor and it's well tolerated. With those three interventions, we can usually get the cholesterol down, combined with a good diet, so that people, even with the high cholesterols, don't have to worry about taking these drugs. Okay.
I'd add to that list would be magnesium. There are so many studies now on the utility of magnesium in prevention of cardiovascular disease. They go on and on. A couple of more useful ones show that magnesium raises the HDL cholesterol. If you recall, HDL is the good guys, and the more of the HDL we have as a total, or as part of the total cholesterol, the lower the coronary risk. Magnesium does most of the things that most of the drugs out there that are prescribed for cardiovascular disease do. For example, magnesium helps to dilate blood vessels. Anyone who's ever had a magnesium shot knows that. And they're a category of vasodilators or blood vessel dilators that are prescribed for coronary effect. There is a big category of drugs out there called calcium channel blockers. Well, there's a professor from the University of California at Irvine, Professor Iseri, who's been writing articles for years saying magnesium is nature's calcium channel blocker. Why do we have to use artificial ones, things called procardia and so forth, to block abnormal flow of calcium when magnesium will do it? Magnesium also helps us to lower the blood pressure in some cases. In fact, there's hardly a cardiovascular use where magnesium does not overlap greatly. That is a cardiovascular use drug, where magnesium does not overlap greatly. It's really quite important on that list that Alan mentioned. Also, we can get some cholesterol-lowering things right out of the supermarket. Now, how many of you have our West Coast grocery chain called Safeway? And how many ever wondered why they call it that? You know, why should anybody call their store Safeway anyway, unless they're trying to convince you of something or other? Well, in your Safeway or other grocery store, you can get carrots. And there's studies showing that carrot fiber lowers the cholesterol. These days you can get soy protein in various forms. It doesn't have to be all that icky stuff in the water pack. Actually, some folks think that isn't so icky, but there's other soy protein too. That will lower the cholesterol. Eating alfalfa sprouts, alfalfa sprouts, that's been shown to lower the cholesterol. Just to shut up on this part of the discussion, in the back of my paperback book, there's a discussion of 27 different foods and nutrients that will lower your cholesterol or raise your high-density cholesterol. You can read up on them there. I think what I'll talk about a little bit about is prostate glands. We'll do that in about 5 minutes. Yeah, okay. Now, some of us have prostate glands, and those of us who don't, well, you can either go to sleep, or you can just remember it for somebody you know who has a prostate gland. For years, folks have been getting their prostate glands carved on. As you know, there's that little Roto-Rooter operation, that's done, and by the time all of us guys get to be 75, the urological journals say, well, half of all the guys out there by the time they get to be 75 need to have that little roto-rooter operation done. And both Alan and I are here to say you really don't. In 1941, some doctors funded by Royal Lee, I suspect there's some folks who remember the name Royal Lee, did a study that involved 19 men. And they had these 19 guys all take the equivalent of approximately a tablespoon of flax oil a day. And of those 19 men, 14 of them had the prostate gland get smaller again. Now remember, the roto-rooter operation is done for enlarged prostate gland. We're not talking about cancer here. We're just talking about enlarged prostate gland. And 14 out of 19 isn't bad, and in 1941 they just checked that by the famous finger test that all of us guys remember if you've ever been in the service or in the doctor's office or whatever. It's not just women who get the pap smear and, oh God, I don't want to see the doctor. Us guys get it too. So 14 out of 19 isn't bad. In 1974, a doctor from Cook County Hospital, he was head of the Department of Urology there, also did a study on prostate glands, and he rounded up 19 men. Now, I'm not sure why you have to have 19 guys to study prostates, but that's what he did. And of those 19 guys, he had them all take zinc. And he was using a form of zinc which we don't really recommend, zinc sulfate. That type causes a lot of gastrointestinal distress. We usually recommend something called zinc picolinate. And he had folks take 50 milligrams of zinc sulfate 3 times a day. And of those 19 men, 16 of them had their prostate glands get smaller. So here we have 14 out of 19 with flax oil and 16 out of 19 with zinc. We have folks usually use zinc 30 milligrams 3 times a day because the picolinate's a little more efficient, and we do offset it with copper, as Alan mentioned. Well, 14 out of 19, 16 out of 19, so when people come into our clinic, we'd say, we're not proud, take them both. And we got better than 16 out of 19, where if it was benign, not cancerous again, this is benign enlargement. Now the doctor at Cook County Hospital, he didn't just use the famous finger test. He used x-rays, he used ultrasound, he used all the modern techniques in 1974 and proved that some 16 out of 19 had their prostate glands get smaller. Well, isn't this good, real modern medicine? So we go back to colonial times in South Carolina, Georgia, and Florida, where the colonists learned from the American Indians. I don't know if you can call them colonists. You know, what if the Indians had required passports for us to get into this country? Or not this country, excuse me. All of us who are from the States to get in. What if they'd required passports here in the Bahamas? You see the Arawaks with the customs authority? Yeah. Anyway, the colonists learned from the Indians that if they had problems urinating, if they happened to be guy colonists, that if they just went out and ate these little berries off the saw palmetto plant, that they wouldn't have trouble anymore. So very recently, some European pharmaceutical companies, they're a little more enlightened in Europe, did double-blind, placebo-controlled studies with men with enlarged prostate glands. And they found out that sure enough, there was something in the saw palmetto berry that caused a remission of symptoms with enlarged prostate glands. So what we do now when folks come in and say, I haven't got cancer, as far as I know, my PSA is okay. That's the prostate-specific antigen test that a lot of us get when we're guys and past 55. That's okay, but my urination's slowing down, and my urologist says, well, either I can have a roto-rooter operation, or I can take this drug called Proscar, which I've got to have Alan explain to us in a minute. Alan's done some fun letter writing back and forth to the head of the advertising department for the Proscar company. Now, Proscar was mentioned in one of my other favorite medical journals, which I only read occasionally when I'm in the airport, the Wall Street Journal. And they said, Proscar is going to be a $1 billion a year drug for the Merck company. And as Alan will explain in slightly more detail, it doesn't work as well as saw palmetto berries. And yet, when the word came out in the Wall Street Journal that FDA was approving Proscar, all the companies that put out saw palmetto berries got warning letters. The same month. What a coincidence. And they all got warning letters that said, you may no longer put on the label of your saw palmetto berries anything that would even hint at what your product might do. You can still sell it, but you can't tell anybody what for. And not only that, FDA goes into the stores and tries to get the clerks to tell them what it's for so they can arrest them. I'm serious. That's on record over and over again. So if you happen to have an enlarged prostate gland or know somebody who does, or even better, know somebody who doesn't want to get one, a little flax oil, a little zinc, and particularly if we're in the right age group, a little bit of the saw palmetto berry extract, which goes under various titles. The generic name is Serenoa, S-E-R-E-N-O-A. And of those 19 enlarged prostate glands, why, we've got a shot at all 19. Seriously. We'll talk a little bit more about that digestive tract. That seems to be something that comes up a lot at our clinic. Everybody digested their coffee? I'm going to have to talk to Chip about that, aren't I? Yeah, coffee, soft drinks, come on, guy. Well, I mentioned about the antacids and how most of the time people, when actually measured, are found to be in need of hydrochloric acid and pepsin if they're taking antacids. Antacids have a place, but it's awfully, awfully small. There's another category of drugs. When they say drug on the market, I think they mean it. Another drug on the market called Tagamet, you've probably heard of. It has a competitor called Zantac and another thing called Prilosec. All of these are so-called acid blockers for the stomach. And most of the folks who take those turn out to be past 40 again. Well, those antacids aren't working, so let's give you some of these acid blockers. Now, paradoxically, the things do remove symptoms. I won't argue with that. But much like the Mevacor stuff that brings down your cholesterol but raises the risk of, I didn't realize those things. This is the ominous music for the drugs. Much like the Mevacor, which lowers the cholesterol but raises your risk of other diseases right back up so that the net funeral rate is the same, much like that, except worse, are those acid-blocking drugs. When a person comes on into the clinic and is taking one of those things and has been doing that for a year or more, I can count on it they're going to have malnutrition. Tagamet, Zantac, Prilosec, and so forth, if taken for more than maybe one dose, lead to malnutrition. Why do they lead to malnutrition? Because when we block the acid and pepsin, we block the digestion of protein into those 8 essential amino acids. We block the assimilation of 13 different minerals, and the vitamin B12 and folate don't get into us either. In fact, there are affirmative studies, which I like better than affirmative action, showing that people who take Tagamet get vitamin B12 deficient, just flat deficient, never mind deficient in the activity of B12, but they get deficient in it because the stomach makes a third factor that comes out of the stomach wall, grabs onto the vitamin B12, forms a complex with the B12 molecule that's needed to get that B12 absorbed into the system. And if we shut that off, of course, the B12 doesn't get in either. Those are very, very bad acting drugs. Now, a couple of things to say about them. What are they used for? Ulcers? Well, you probably know, and most in this group seem to do a lot of the reading, that it's been found that ulcers, very, very likely, the majority of the time, have to do with a little bacterial guy called Helicobacter that undermines the wall of the stomach so that even the least little amount of acid might break through a weakened wall of the stomach and cause an ulcer. So sure, if we block the acid totally, it won't break through that weakened wall and maybe it can heal it. But does the Tagamet do anything or does the Zantac do anything to promote healing? Of course not. It just blocks the ulcer. And to get after the Helicobacters, if we have an ulcer and it's really caused by these little Helicobacter guys, and by the way, there's a blood test for that. It's just called a Helicobacter antibody test. To get after those, oddly enough, someone found that one of the major things that works is, get this now, Pepto-Bismol. Why has that been on the market for so long for soothing stomachs? Even though it's over the counter, why hasn't it just died out? Well, apparently it works sometimes. The bismuth in the Pepto-Bismol kills the helicobacters, and when they die off, then the stomach can recover itself. But I'm not here to advocate taking Pepto-Bismols, necessarily. There are other ways of getting rid of the helicobacter. Just for example, some very innovative physicians in New Zealand found that tea tree oil killed helicobacter. So one can take 15 to 20 drops of tea tree oil in a small amount of water, swallow that down 2-3 times a day. If you can swallow tea tree oil, it's kind of strong. Tea tree, that's T-E-A, next word tree. And you'll find that in just about all the health food stores. Tea tree oil is one of the more useful antiseptics, in fact. It kills a variety of bacteria, funguses, without interfering with human tissues. It's just something that apparently the natives in Australia taught to the colonists who came over once again without a passport, and was used by the Australian Armed Forces when our armed forces were using penicillin. And they were doing just as well with the tea tree oil. Now, how these doctors in New Zealand decided to give the tea tree oil was in honey. They actually had the bees feed on tea tree flowers, make honey, which had a lot of the tea tree constituents in it, and then they fed that honey to the people with helicobacter, and what do you know, it killed them. So that's one possible way of clearing up a helicobacter-type ulcer. Now, if we give that Tagamet or Zantac or whatever to a child, which happens quite rarely but occasionally happens in our community, I think we're doing an enormous disservice to that child. Children are growing. They need nutrition not only for maintenance and repair of tissues, but they need the protein to grow. They need the calcium. They need all of those things to grow their little bodies. And if we block out 23 different nutrients with a drug, something's likely to go wrong. Something's likely to go very wrong. So what are some other alternatives? Well, one of my favorite prescriptions at the clinic, because it has very many uses, turns out to be licorice. Now, when I prescribe that for the kids, they say, "What? I get to eat licorice?" Sure. It turns out that licorice has in it components which actually lead to regeneration of the cells that line the stomach. Now, licorice also has in it a component which can raise the blood pressure in some cases if a person takes a lot of it. Last time I looked at the statistics, you need to eat over a quarter pound of licorice a day to raise your blood pressure. But it can be done. So one of the processors of health food type stuff processed licorice and took out the component which raises the blood pressure, which happens to be called glycyrrhiza. And they produced something called deglycyrrhizated licorice, which is the first time I pronounced it correctly today and probably the last time. Otherwise known as DGL for the deglycyrrhizated licorice. Did it again, but I can't spell it. And a number of studies were conducted in England comparing the effectiveness of ulcer healing of the Tagamet stuff to the effectiveness of healing of the DGL stuff, or deglycyrrhizated licorice. And what they found, when you boil all the studies down to statistics, are that the DGL was just as effective at healing up ulcers and more effective at preventing them from coming back if the licorice was chewed up thoroughly and then swallowed in that form. And just swallowing the capsule didn't work so well. Chewing it up and getting the licorice goo down there helped to heal the ulcers. Now, remember I mentioned that the licorice helps to regenerate the stomach lining cells? Aha! What if your stomach isn't making very much acid and pepsin to start with, and you're having to take that hydrochloric acid and pepsin and 8 capsules with a meal? Just hydrochloric acid and pepsin? I hear that a lot, but the average adult dose does turn out to be 6 of them, and people get very tired of that. Well, we've run stomach analyses that check for acid in a person's stomach, found folks who have just no acid and pepsin down there. No wonder there's a doggone tired out. They're not assimilating their nutrients. And as part of an overall program, have had one of the mainstays of that will tell people, go home and eat licorice. And keep your stomach coated with licorice goo whenever you can. And some of those folks have come back and their stomachs are working again. The stomach lining regenerates somewhat for these folks. Remember I mentioned it would raise the blood pressure? Well, there are a number of people, it's not a majority, it's a minority, who go around with low blood pressure. If you happen to be European, low blood pressure is a disease, and you get treated for it. If you happen to be an American, or a Bahamian maybe, if you happen to be that, low blood pressure, nothing matter with low blood pressure, that's just fine, it won't bother you any. And what we find is that low blood pressure actually is one of the many symptoms of weak adrenal glands. Remember, adrenal glands are these glands that have to handle stress, all sorts of stress. Emotional stress, physical stress, drug stress, even good stress has to be handled by the adrenal glands. And some of our adrenals just aren't strong enough to handle it. They get sort of worn down. And some of us, and it seems to be more women than men, when that happens, we end up with low blood pressure that's 104 over 70, 100 over 60, 96 over something or other. Well, that's usually weak adrenal glands, and that's something we do need to work on. But one of the things that we can help ourselves with is, again, licorice. Turns out it's why it's one of my favorite prescriptions. Licorice slows the breakdown of the adrenal hormones in the liver. Remember, every molecule in the body builds up, breaks down every day. And the hormones from the adrenal glands are broken down mostly in the liver. And licorice, in moderate quantities, slows that breakdown. It's like putting a dam in the stream, so you build up a pond behind the dam, so we can build up more adrenal hormones. We don't actually manufacture anymore, we just don't break them down as much. And if we conserve more adrenal hormones in our systems, why, that blood pressure comes up a little bit. And some of us who are feeling stressed, if we get the blood pressure up a little, which is an outward marker of just simply conservation of adrenal steroid hormones, why, we feel better. Now, I was working with a gentleman one time who was in his 80s and having dizzy spells. And he'd been to this doctor and that doctor, and, well, you're just having dizzy spells, and take this drug and that drug, and they mostly didn't help, gave him various symptoms. So we checked, and sure enough, he was a little bit on the weak side in the adrenal glands, but rather than having him take substitute hormones, turned out he liked licorice. So told him, well, go eat licorice or drink licorice tea, and make sure you check your blood pressure every once in a while, it doesn't go up too high. And his blood pressure was generally running around 90 over 60 or so, and he'd get kind of dizzy. About a year and a half later, I got a middle of the night call from the emergency room saying that this gentleman was in there, and his blood pressure was 220 over 140, and did I know anything about that? So I asked the emergency room doctor to go back and ask him, or his wife who was with him, how much licorice he was drinking. Turned out he wasn't too with it, but his wife said she tried to stop him, but he was drinking 6 pots of licorice tea a day. He'd really gotten to like the stuff. And he wasn't dizzy anymore. But he was in the emergency room with an awful bad headache. So the licorice can be overdone for that particular use, but if we stick to the deglycyrrhizonated type, if we happen to be scared of that, or if we just go get our blood pressure checked every once in a while, then licorice can be used for its twin effects, and it has many more than these, but the two that are quite useful is leading to regeneration of the stomach lining cells and actually healing up ulcers. And while we're at it, if someone comes into our clinic and says, I'm taking Tagamet, I'm taking Zantac, I'm taking whatever, we'll say, okay, off of that this minute. That's going to cause you malnutrition. Go get yourself some of this deglycyrrhizonated licorice and chomp on that and just keep your stomach saturated with it. It's extremely rare that anyone says that that doesn't work. Now, if you're a little kid, that's neat, I get to eat licorice for my stomach. We don't run into too many kids who are taking those drugs. So there's a lot of use we can make, not only of the vitamins and minerals and so forth, but also of the botanicals. I'm sure you've read some good books on that too. Now, go over one other thing that once again relates to that tummy. I guess I should say two other things. One of them is bursitis. I bet you at least one person in the room has had bursitis. And what are we given for that? Well, we're given Alan's favorite, another sort of aspirin in disguise for the bursitis. Take ibuprofen, take aspirin, take one of those sort of things. Back in 1957, a Dr. Clemens published an article in a magazine called Industrial Medicine and Surgery, where he had worked with 40 people who had bursitis, mostly bursitis in the shoulder, a couple of cases of bursitis in the hip. And what he'd had these folks do was to take a vitamin B12 shot every day until the pain went away. And as he said in his publication, in all but 2 cases, an injection of vitamin B12, and B12 usually comes in 1,000 micrograms per cc, and he was having people use 1 cc or 1,000 micrograms every day, not in the bursitis, in the body somewhere. He said that in the majority of cases, the pain went away substantially in 72 hours. And in all but 2, it cleared up within 2 to 3 weeks, no more bursitis. And if people just kept taking those B12 shots, why, their bursitis stayed away. And they didn't have to take it every day. They just take it every day till the pain went away. If the pain started coming back, they'd hit themselves with 2 or 3 more B12 shots. Pain would go away again, and so forth. Well, of course, that gets you to thinking, if you have to use a shot, and it doesn't work so well by swallowing it, is the stomach working? No. Somebody comes into our clinic with bursitis, we say, oh, you need these B12 shots, and by the way, go get your stomach checked. Remember, if something will get better with a B12 shot, and it doesn't get so much better when you're swallowing your B12, maybe you're not absorbing your vitamin B12. That's actually the major vitamin that requires injection, not just in adults with bursitis, but to take off from that a little bit, the doctor had x-rays taken of people with the bursitis, and he found a few of them who had calcium deposits in the shoulder. He had those people continue taking their B12 shots once a week, and he did an x-ray every 6 months. And what he found was that the calcium deposits would fade away with a B12 shot once a week. So every once in a while, Alan and I have an original idea. So one of us thought, well, if it makes the calcium deposit go away there, let's try it for people who have heel spurs. Remember, those are large calcium deposits on the end of your heels? Well, last week, before I left the clinic, somebody came back and said, oh, by the way, remember you told me to take B12 shots for my heel spurs a couple years ago? I said, yeah. She says, well, it took 6 months, but after 6 months of shots once a week, they quit hurting and they haven't hurt since. I asked her if she'd had her heels x-rayed again to see if the spurs were any less. She said, no, why bother? They don't hurt, and the x-ray costs money, which I guess is a good point of view. And by the way, the B12 gives her more energy. B12 is a little bit of a sexist vitamin. About 70% of the women who take it say, can I take a little more? I feel more energetic. And we'll say, sure. The only way you can overdose on vitamin B12 is to fill your bathtub with it and drown. So take it as you feel you need it. But for us men, I'd say it's maybe 2 or 3 out of 10 who say, oh yeah, I could feel that stuff. And the other ones say, I got this hole in my leg once a week. Do I have to keep taking that? And that's called a clinical trial. And if folks don't feel too much better with it, even though if we really know they need it, we'll say we'll take it once a month. There's one other situation where vitamin B12 injections are very, very useful. I do like to push this one, even though there's no little ones here, and that is in asthma. Now, back in the 1930s, a doctor who was an asthma specialist checked 200 kids who had wheezing and found that of those 200 kids, 160 of them didn't have enough acid and pepsin produced by their stomachs. We're back to that old acid and pepsin. I'm sorry today is acid and pepsin day for me, but a lot of things that relate to that. 160 out of 200, that's 80%. So at the time, this was 1931, he had the parents put hydrochloric acid drops in with the liquids the kids were drinking and swallow that down with their meals, and their asthma got a little bit better. But if we fast forward that whole thing to 1957, a Dr. Crockett in England gave kids vitamin B12 shots for their asthma, and he found that 80% of the kids improved. Probably the same 80%, because remember, if the stomach isn't making acid and pepsin, it doesn't make the factor that combines with the vitamin B12 and pulls the vitamin B12 into the body. So he gave them shots of B12, and what do you know, their asthma got better. Now, just to shorten this way up, because we are under some time pressure, as Chip says, Alan and I usually do this in about a 3-day course. To shorten this way up, when kids come into our clinic who happen to have asthma, if they're kids under 20, I really do mean kids, we have the parents learn to give them, or if they're old enough teenagers, they learn to give themselves an injection of vitamin B12 every day for a month. I'm not kidding. And 50% of the kids, the asthma's gone. Now, I'm just talking about the wheezing. I'm not talking about the underlying allergies. We still have to work on those. That's very, very important. But the wheezing response, the stuff, that the wheezing that is the asthma that is killing more and more kids every year. Have you read that? The death rate from asthma is going up and up and up. Well, the wheezing response is gone in half the kids. In 30% of them, they're a lot better, but it's not gone. In 10%, it's a little better, and it only fails about 10% of the time. After those daily shots of vitamin B12, then we'll tell the parents, taper them off until you reach sort of a balance point where the child doesn't wheeze anymore if you give it to them every 5 days or every 8 days or whatever it is. It's very, very effective, and nobody ever OD'd on vitamin B12 and killed themselves or even came close. So if you happen to have any kids or grandkids or know anybody who has asthma, that's an extremely effective tool for the wheezing part. You still need to work on the allergy. Now, a word about the allergy. In 1976, some doctors rounded up families, this was done in Scandinavia, where both parents, all 4 grandparents, and a couple, 3 of the kids were allergic to milk, cow's milk. And then they made sure to work with an infant which was just about to be weaned from mom but had never had anything at all besides mother's milk. They put a biopsy tube down this kid's stomach, and I hope the kid signed the consent form, and took a biopsy, and oh, that looks like a nice normal stomach. And then they gave these kids 1 dose of cow's milk. 1, that's all. And the next day they put another biopsy tube up the nose, down the stomach, and biopsied the stomach. This is all published in the European Journal of Pediatrics along with photomicrographic pictures. And the second biopsy, they look under the microscope and they say, oh God, that stomach is destroyed. The lining of the stomach is all these little finger-like projections that you see in textbooks that are the absorptive surface. They're destroyed. The stomach lining is full of cells that will come out with allergy called lymphocytes. And those kids' stomachs don't produce normal acid and pepsin for 3 to 6 months after 1 dose of cow's milk. Now, if you've destroyed your stomach like that for 3 to 6 months, and your parents don't happen to know that you're allergic to milk because, oh, that's just another case of colic, right? And you get a dose of milk pretty routinely, every day, once a week, then you can grow up to be 26 years old and never know that your stomach isn't working right because it's felt like that ever since you were a little kid. Yeah. So it appears, and remember, if you've destroyed your stomach with cow's milk and the acid and pepsin aren't being manufactured, you can't absorb the vitamin B12. So it appears that the one thing that we know of that milk might be a cause of, milk might be a cause of asthma. Not by affecting the lungs, by affecting the stomach. Now remember though, the B12 only worked 80% of the time. That's good enough, but that does mean there are some other causes too. But one of the major causes of asthma appears to be stomach destruction by cow's milk in children and not absorbing vitamin B12. And you probably have seen the research that says that in 176 out of 176 cases of juvenile onset diabetes, it was discovered a very, very intense allergic reaction to one of the protein factions of cow's milk, again. And if they got the kids totally off the cow's milk and worked with settling down that immune reaction, then the juvenile diabetes would go into remission. Cow's milk is for little cows. And if you're not a little cow, or your kids or grandkids aren't little cows, please don't give them cow's milk. Those are only two of the things, juvenile diabetes and asthma, that you can lead backwards in a direct trail to putting the cow's milk into the person. Well, it isn't fair. Cows don't drink people milk, so why should people drink cow's milk? But aside from a specious argument like that, giving a protein from one species directly to another species like that without any predigestion and so forth just really isn't a good idea. So, when Alan was saying that some basic stuff like removing sugar, food chemicals, caffeine, and allergies can do us a heck of a lot of good, of course it can. It can start us on the road to clearing up asthma, sometimes juvenile diabetes. And if we remember what the milk has done sometimes, I'll run into people 65 years old with no acid pepsin production by the stomach, been sickly, not well all their lives, and we can track it back to a cow's milk allergic family and a person who didn't know they were allergic to cow's milk, destroyed their digestion, didn't get their nutrients in, and so forth. Alan, you're on.
Thank you, sir. I disagree with you about something.
You do?
I think cow's milk is also for little bulls.
Did I say no bull?
Okay, this is where we get into the Heckle and Jekyll show here. I tell you everything that he said that was wrong, and then he tells me I don't know what I'm talking about. Actually, I agreed with pretty much everything he said. I don't want anybody to be left with the impression that you can reverse juvenile diabetes once it's already been established. If you catch it in the process when the pancreatic tissue is being destroyed, there may be some value. It's also been shown that taking niacinamide at that time might stop it in its tracks. But once somebody's already on insulin and has had this established for a long time, you're not going to be able to reverse it by getting anybody off anything at that point. The other thing, as far as the licorice, licorice is very interesting because before they discovered cortisone and people had adrenal failure known as Addison's disease, the treatment of choice, it's a good term, the treatment of choice, that's the people that have the medical licensing power, tell you what to do, that's the treatment of choice, was licorice. And then they discovered cortisone and they didn't need licorice anymore. Well, in fact, licorice sometimes works better than the hormones because it raises the level of a lot of different things that are from the adrenal gland rather than just the cortisone-like products. But be aware that you can overdose on licorice and it should be monitored. In addition to raising blood pressure, it can deplete potassium. So we always tell people to eat a lot of fruits and vegetables, and if they're on a large dose, to get the potassium checked occasionally. The other thing, I want to re-emphasize what Jonathan said. When you're healing peptic ulcers, and it does work very well, use the form that has the glycyrrhizin removed, deglycyrrhizinated licorice, or DGL. It's available in health food stores, and 97% of the glycyrrhizin has been removed. So that's not 100%. There's still a little bit of glycyrrhizin in there, and in theory, you can get a glycyrrhizin effect. And I never thought it was enough to do anything until one day a patient came in who was on cortisone, and I was giving it to her medicinally in very small amounts, and she started DGL, and she got all these cortisone side effects. She stopped the DGL, cortisone side effects went away. So in her case, it kept the cortisone product in her body a lot longer, and she experienced side effects. So let's treat this stuff with respect. In general, DGL is perfectly safe, but if you're on cortisone, you've got to be extremely careful with it. And if you're eating more than it says on the bottle, which is 3 to 6 tablets a day, then you should get monitored on that. Another thing I wanted to mention, Jonathan talked about the drugs Tagamet and Zantac and Prilosec. That includes 2 others called Pepsid and one called Axid, A-X-I-D. They all are acid blockers, but something that the doctors tend to forget they're also called histamine blockers, H2 blockers for those of you in the medical profession. And what does histamine do? Histamine is one of the mediators of allergic reactions. So it brings us right back to what you're saying, that allergy can damage the intestinal lining, and you take an H2 blocker, shuts off the acid, but that might not even be why it works. Because as Jonathan points out, some of these people don't have any acid in the first place. And yet the H2 blocker works perhaps because it's blocking the allergic reaction. So if somebody benefits from Tagamet or Zantac, we should think maybe they've got some food allergies to look at. Okay, I also wanted to mention another condition that occurs in childhood due to milk allergy. It's called nephrotic syndrome. And this is not rare, although it's not common. And in one study of 6 children that had this condition, it's where they put protein out in their urine. And they can end up getting all puffed up and swollen and get protein deficiency, and their cholesterol level goes off. It's a kind of kidney disease. The kidney spills protein. And in 6 children that had nephrotic syndrome who were having to take cortisone, they were all taken off the cortisone, and at the same time they were taken off of all dairy products. And when they went off the dairy products and the cortisone, they didn't get worse. And then they challenged them with milk products, and boom, 5 out of 6 people got worse immediately. They started putting protein out in their urine. So in this very small study, that suggests that 5 out of 6 cases of childhood nephrotic syndrome are due to milk allergy. Well, brings us back to Cal Ripken, the most valuable plant. Why did they even name him Cal anyway? They knew he was going to be doing milk commercials when he was born. His father's named Cal also, right? It's another story. So if milk is so bad for us, where are we going to get our calcium? That's a good question, because in other parts of the world they don't drink milk, like in India and in China, and yet the incidence of osteoporosis there is substantially lower. So we have this thing about if we don't drink milk, we're going to get bone loss. And yes, there are a few studies that say that drinking milk increases the bone density, but it's only in people who aren't getting much calcium in their diet. If your calcium intake is greater than 500 milligrams per day from any source, then there's no evidence that taking extra calcium does any good for your bones. In my book, Preventing and Reversing Osteoporosis, which just came out, and there are a few left on the back table there, I believe, I pointed out from a bunch of research which has come out in the past 10 years that bone health depends on a lot more than just calcium. Bones are more than just chalk. They have active biochemical processes going on, and as any other living tissue in the body, it has requirements for various vitamins, various minerals, various hormones. And if we just supplement with calcium, we're not going to do that much good. And furthermore, if we take a lot of calcium, like the doctor says take 1,500 milligrams a day, that's going to actually start interfering with the utilization of some of the other important nutrients, specifically zinc, magnesium, and manganese. And all of those have an effect on bone density and keeping your bones strong with age. The only nutrient that so far has been documented to increase bone mass in postmenopausal women is magnesium. And this was published, it's actually in press, it hasn't been published yet. It's in a journal called Magnesium. It's not one that people get. The doctors read the Journal of the American Medical Association called JAMA. We like to call it the Paleolithic Journal of the American Medical Association, which is PAJAMA. Or also the prestigious New England Journal of Medicine. And if it's not in those two, it's often not read or believed. And Magnesium is a European journal. It's all this good stuff about magnesium. Well, a report on this appeared in the Medical Tribune, which is a news magazine about medicine, and they said that of 31 postmenopausal women who took magnesium supplements, dosage being 250 to 750 milligrams per day, 75% of them had an increase in their bone density over a period of 2 years. The increase was 1 to 8%. Now that may not sound like a lot, but the natural history of the disease, and I don't know what we mean by natural history either, that means if you do what the conventional doctor tells you. The natural history of osteoporosis at menopause is that you lose between 3% and 8% of your bone density per year for 3 to 5 years, and then it slows down. You still lose bone, but not as fast. And this instead was an increase over a 2-year period of 1 to 8%. So this is the first nutrient that's been shown to do this. Calcium supplements have never been shown to reverse bone loss. They've only been shown to slow down the loss. So maybe we're looking at the wrong mineral here. If you're deficient in magnesium, the body will not metabolize calcium normally. If you take a rat or a chicken or a guinea pig, give them a consent form to sign, and then take the magnesium out of their diet, they develop abnormal calcification. They develop atherosclerosis with calcium deposits. They develop calcification of their kidneys and kidney stones, and they develop other soft tissue calcium deposits where they don't belong. So what we're seeing here is abnormal calcification caused by magnesium deficiency, and that is exactly what occurs in the bones when they did a study of 19, again that 19 number. You all know that was Johnny Unitas's number. I'm from Baltimore. When they measured the magnesium status of 19 women with osteoporosis, 16 of them had magnesium deficiency, and all 16 of them had abnormal crystallization of their bones. The crystal formation was unusual and presumably weaker than normal bone crystal. The other 3 women had normal magnesium levels, and in each case, their bone crystals were normal. So the conclusion there is that magnesium deficiency is common in osteoporosis, and it is associated with abnormal bone mineralization. That is an extremely important finding, and it suggests that magnesium supplementation may be more important than calcium in preventing this condition. Other research deals with the effect of the trace mineral manganese. How many of you remember the famous basketball player Bill Walton? Okay, I guess he wasn't that famous. Okay, more people. Okay, wake up, thank you. All right, most of you remember him. He was good. He played for UCLA. He was